Welcome to iHeartRadio's CEO Unplugged. I'm Joe Bartlett, and our guest today is one of the leading cancer researchers in the country. Let's welcome Dr. Stephen Libutti. He's the director of the Rutgers Cancer Institute of New Jersey and the senior vice president of oncology services for RWJ Health. Dr. Libutti's work focuses on developing novel cancer therapies. So it's great to talk to you this morning, Doctor. And, I know there's some exciting things happening in the field of cancer research. Can you just tell us, what's going on right now?
Well, first off, it's great to be here, and thanks for having me. So, cancer research is exploding now. I think what's really led to that is finally a lot of the technologies necessary for us to understand cancer as a disease and better understand cancer biology have really matured over the last especially 10 or 15 years. I've been engaged in cancer research now for close to 30 years, and I can say that the last 8 or 10, we've made more progress than we did in all the time before that, at least in my career, the 30 years that I've been engaged in research. But some of the most exciting progress that's being made right now is in areas we call precision medicine, where we're actually understanding the mechanisms in cancer that we can target directly to try to maximize the effect of the therapies and minimize toxicity. And then cancer immunology, which is really harnessing the patient's own immune system to fight against cancer. I'd say those are two of the most exciting areas at the moment.
Before we get deep into that kind of research, let's talk about the Rutgers Cancer Institute. Now, I understand it's New Jersey's only comprehensive cancer center and just one of several in the nation. So what does that mean for New Jersey?
So we're one of only 50 National Cancer Institute designated comprehensive cancer centers. And what that means is that the National Cancer Institute, which is a major research organization in the United States, probably the leading institution that funds cancer research from a federal government perspective in the U.S., really sets standards for cancer centers across the country to meet across the spectrum of cancer research, cancer clinical trials, and cancer care delivery. And so institutions will apply to the National Cancer Institute for this very competitive designation. And right now, as I said, there are only 50 NCI-designated comprehensive cancer centers in the country, and we're the only one in the state of New Jersey.
Tell us about the partnership with RWJ Health. How does that work? And I assume that just increases your reach.
Well, it's a tremendous partnership, and as you can imagine, cancer research is only as good as how we can apply that research to help treat cancer in patients. And it's really our mission at the Cancer Institute to decrease the burden and suffering and death due to cancer for patients throughout the state and beyond. And RWJ Health, as the largest health system in the state of New Jersey, really gives us a platform to reach the largest number of patients. And so the Cancer Institute of New Jersey really serves as the cancer care providers across the RWJ Health system.
Well, one of the areas you mentioned was immunotherapy, and I'm really excited about that. I've been involved in raising money for childhood cancer research for a number of years, and I know some researchers that are working on immunotherapy, and to me, that's a very promising field.
It's extremely exciting, and while immunotherapy is not new, it's been around for quite some time in terms of an area of research. What's most exciting about it is finally our understanding of the immune system and how the immune system can react to tumors has matured enough that we're really starting to make progress in terms of FDA-approved therapies that harness the immune system to fight against tumors. And the side effects you can still see, but they're different than chemotherapy side effects, but the specificity of how the immune system can react against cancer is what's really exciting and very promising. And so if we're able to expand the types of cancer that immunotherapies will work against and continue to lower the side effects or toxicity, I really think it can become truly the fourth leg or column of options we have for treating cancer, along with surgery, chemotherapy, and radiation therapy.
You know, in the past, I mean, what would happen when a person came down with cancer, you would just get bombarded with chemotherapy and radiation, I mean, to the point of death. and now, and this is especially troubling when it comes to children, pediatric cancer. But now the treatment is a little less severe. Well, I would say a lot less severe, right?
Well, especially when we're thinking about children, we have to not only consider treating the cancer, but what are going to be the long-term consequences of the therapies that we're applying in that case. We have a lot of research going on at the Rutgers Cancer Institute under the leadership of Peter Cole, who is our chief of pediatric oncology. And Peter's major focus is on the consequences of chemotherapy in children, especially around cognitive function. And I think that's an area where we need more research in terms of making certain that the treatments we give aren't, worse than the disease in terms of their long-term consequences.
Tell us a little bit about the study that goes on, the case studies that you do, and how the research is done. Because obviously, when you treat patient, you're taking data from them, you're comparing it with data from other patients, and it's a collaborative effort with a number of organizations. So tell us how that works.
So the continuum of performing cancer research is really as you describe. And so we perform cancer research in the setting of delivering outstanding cancer care. And so the Rutgers Cancer Institute and our cancer service line across RWJ-Barnabas Health is really focused on treating patients with cancers now. And so we apply what are called standard therapies or FDA-approved therapies for the treatment of cancer. But in concert with that, we are constantly studying disease in those patients and actually studying the disease in the laboratory to better understand what are the mechanisms that drive cancer growth and spread, and how might we leverage that knowledge of those mechanisms to develop next generation therapies. And so it's a team effort. The patients are a part of that team. And we also partner with outside entities, whether it be the federal government that provides grants or other associations that are very focused on raising money for cancer research, which is incredibly important because it's those resources that allow us to make the progress.
We've heard a lot of talk about breakthroughs in cancer. Every once in a while you get these stories. There was even one suggestion that maybe there might be a vaccine coming. I know a lot of that is fantasy, but are we really getting to a point where we will make quantum leaps in this research?
So the history of progress in cancer has been more major progress than gaps of accumulation of knowledge and then leveraging that knowledge and making major progress. And so it comes a little in a staccato sort of rhythm, but I think we're in a time right now where the technology is there for us to apply to the questions, whether it's the ability to sequence DNA much more effectively in tumors and understand better about changes in genes that may lead to the formation of cancer. As I mentioned earlier, our knowledge around precision medicine has really gained a lot over the past decade. But it's still critically important that we rely on the less technically fancy approaches, and that's really around screening and prevention. And so we know a lot of causes for cancer, and if we can educate the population to sort of recognize risk factors and try to lower those risk factors, if we screen patients more effectively and catch cancers early, if we can catch cancer early or prevent it from occurring in the first place, I think that's as important as these new, very technologically exciting breakthroughs that allow us to treat established tumors.
Actually, that is a two-pronged attack because we are preventing a lot of cancer with treatment and screening, and we are able to even cure cancer. So that's good. A lot of good news. Another interesting program at the Rutgers Cancer Institute is the Oncology Nurse Navigator Program. Now, I know a lot of focus on cancer treatment is the doctor, but the nurse is extremely important as well. Tell us about that program.
So this is actually something that I think is incredibly important. And I think any one of your listeners or anyone recognizes that some of the worst words a patient can hear is that they have cancer, that they get a cancer diagnosis. And for many other diseases, you immediately think, okay, well, they're going to do a quick procedure or put me on a medication, I'm going to get better. But with cancer, there is a much more negative sort of end game that you think about. And so I believe one of the first things you can do as a positive for a patient with a cancer diagnosis is to lift some of the burden of the unknown, the fear that those patients have. And the best way to do that, in my opinion, is with information and with knowledge. And so nurse navigators, the way that we deploy them, are really there to be a source of information, a source of support and navigation for the patient after they get that initial cancer diagnosis, and then throughout their journey through their cancer care, and then hopefully, ultimately, a cure of their cancer, and then during the period of survivorship as they are followed to make sure the cancer doesn't come back. And so we have a commitment at RWJ Barnabas to have a navigator for every cancer patient. And that's our goal, to be able to have a robust, strong enough nurse navigator program for cancer patients where every cancer patient gets that level of navigation.
That's important for the treatment. Tell us where our listeners can get some more information about the Rutgers Cancer Institute.
So for information, you can check out our website, which is at www.cinj.org. And there you can find out information about our programs, clinical trials, our navigation program, the research going on at the Cancer Institute, and the cancer care that we provide across RWJ Barnabas Health.
Thank you. Our guest today, Dr. Stephen Libutti, the director of the Rutgers Cancer Institute of New Jersey, Senior VP of Oncology Services at RWJ Barnabas Health. And for iHeartRadio CEO Unplugged, I'm Joe Bartlett.